You measure your blood pressure. The top number looks great, maybe 120, maybe 125. You feel good about it. But then you look at the bottom number, 90, 95, maybe even 100. You wait 5 minutes, you sit perfectly still, you breathe, and you test again. The top number drops a little, but that bottom number? It's stubborn. It refuses to budge. It's just stuck there, hovering near triple digits. If you've watched my previous videos on pulse pressure, you know that when these two numbers get too close together, like 120 over 100, it puts a unique kind of strain on your heart's circulation. But today, we aren't just looking at the gap, we are going to tackle the root cause of that problem: isolated diastolic hypertension. Essentially, your heart is squeezing just fine, but your arteries are refusing to relax. You are in a constant state of tension, even when you're sleeping. Why does this happen? Is it salt? Is it stress? Is it something hidden in your diet? In the next 15 minutes, we are going to look at exactly why that bottom number gets stuck, and I'm going to give you 3 specific natural protocols involving minerals, a specific red tea, and a very strange hand exercise that can help unlock that pressure. Now, let's look at the plumbing. To fix the bottom number, you have to understand what it actually is. Imagine a garden hose. When you turn the tap on, water flows out. That forward pressure is your systolic, the top number. That's the squeeze. Now, imagine you put your thumb over the end of the hose to stop the flow. The pressure builds up behind your thumb, pushing against the rubber walls of the hose. That resting pressure, that is your diastolic, the bottom number. If your bottom number is high, it means there is too much resistance in your pipes. Your arteries are clamped tight. We call this vasoconstriction. Normally, your arteries are elastic. They expand when the heart pumps, and they relax when the heart rests. But for many of you watching this, your arteries are stuck in a constricted state. They are tight. This forces that bottom number up. So who is squeezing the hose? Usually, it's your sympathetic nervous system. This is your fight or flight mode. In the modern world, we are constantly bombarded. Emails, traffic, breaking news, blue light from screens. Your body thinks it's being chased by a tiger 24/7. When you're in danger, your body releases adrenaline. Adrenaline tells your arteries, clamp down. We need to push blood to the muscles so we can run. But you aren't running. You're sitting on the couch watching YouTube. So that pressure builds up, but you have nowhere to send that energy. This is why standard advice often fails for diastolic pressure. You don't just need to eat less salt. You need to teach your arteries to physically relax. Let's start with protocol number 1, rebalancing your minerals. If calcium is the mineral that helps muscles contract and squeeze, then magnesium is the mineral that helps them relax and release. Your arteries are lined with smooth muscle. If you're deficient in magnesium, calcium takes over, and those muscles stay tight. This keeps your diastolic high. And here's the reality. Up to 50% of people are magnesium deficient. This is often the first thing functional medicine practitioners look at for high diastolic pressure. You need to get more magnesium into your system, but not just any kind. You want to avoid magnesium oxide. It's cheap, it's poorly absorbed, and it mostly just works as a laxative. That won't help your heart. You want to look for magnesium glycinate or magnesium taurate. Taurate is specifically good for cardiovascular health. Taking 200 to 400 milligrams in the evening can help the nervous system switch off and physically loosen the arterial walls. But magnesium has a partner, and that is potassium. We spend so much time demonizing sodium and salt, but sodium isn't the enemy, it's the imbalance. Your cells work on a sodium-potassium pump. You need potassium to push sodium out of the cell. If you don't have enough potassium, the sodium stays trapped inside, holding on to water and increasing the pressure in your vessels. Most people think bananas are the king of potassium. They aren't. They're full of sugar, and you need to eat 10 of them to get your daily requirement. For diastolic pressure, you want avocados. One avocado has nearly double the potassium of a banana. You also want cooked spinach and beet greens. You need a massive amount of potassium, 4,700 milligrams a day. It is almost impossible to supplement that much safely in a pill, so you must eat it. If your bottom number is stubborn, make a salad with avocado, spinach, and salmon your daily medicine. Now, let's move to protocol number 2, the liquid vasodilators. We've talked about minerals, now let's talk about molecules, specifically a gas called nitric oxide. This is your body's natural vasodilator. It signals the inner lining of your blood vessels, the endothelium, to open up. When they open, the resistance drops, and the diastolic falls. As we age, our bodies produce less nitric oxide naturally. We need to supplement it through food. The most potent tool for this is hibiscus tea. This is my favorite remedy because it's so easy and effective. A famous study published in the Journal of Nutrition found that drinking 3 cups of hibiscus tea daily lowered systolic and diastolic pressure significantly, comparable to some pharmaceutical medications like captopril. Why? Because hibiscus acts like a mild natural ACE inhibitor. It helps relax the veins, and it's a diuretic, meaning it helps you pee out excess sodium. The recipe is simple. Steep dried hibiscus flowers in hot water for 5 to 7 minutes. Add a cinnamon stick for blood sugar balance. You can drink it iced or hot. It's tart, almost like cranberry juice, and your arteries love it. If you're not a tea drinker, your backup option is beets. Beets are rich in dietary nitrates. Your body converts these nitrates directly into nitric oxide. You can eat them roasted, or for a more therapeutic dose, drink 1 cup of raw beet juice mixed with a little apple or carrot. Studies have shown this can lower blood pressure within just 3 hours of consumption. But here's a weird tip. Don't use antiseptic mouthwash right after eating beets or drinking the juice. The bacteria in your mouth are actually what convert the nitrates into the form your body can use. If you kill the bacteria with mouthwash, you lose the blood pressure benefit. Chew your beets slowly and let your body do the work. Now, protocol number 3. This is the secret weapon. What if I told you there's an exercise you can do while sitting on your couch that is scientifically proven to lower diastolic pressure? It's called Isometric Handgrip Training. The American Heart Association has actually recognized this as a valid alternative therapy. Here's exactly how to do it. You need a stress ball, a tennis ball, or a simple hand grip tool you can buy online. You're going to squeeze it with one hand. You don't need to crush it. Squeeze at about 30% of your maximum strength. Now, hold that squeeze for exactly 2 minutes. Do not let go. After 2 minutes, rest for a minute. Then switch hands and do the other side for 2 minutes. Do this for 4 rounds total, 2 per hand. It takes about 12 minutes. Why does this work? When you hold that squeeze, you are momentarily restricting blood flow to the arm. When you let go, your body reacts to that shortage with flooding the vessels with nitric oxide to open them up wide. It's like flushing the pipes. Do this 3 times a week while you're watching the news or your favorite show. It requires 0 cardio, but the effects on your resting pressure can be profound if you stick with it for 8 weeks. So, we have the minerals, the tea, and the hand grip. But you can do all of this, and if you're accidentally poisoning your progress, the numbers won't budge. I want you to check 3 hidden saboteurs immediately. First, NSAIDs. Are you taking ibuprofen or naproxen for headaches or joint pain? These painkillers cause your body to hold on to sodium and strain the kidneys. They are notorious for raising diastolic pressure. If you take them daily, talk to your doctor about alternatives. Second, sleep apnea. If your partner says you snore heavily, or if you wake up gasping, your oxygen levels might be dropping at night. When oxygen drops, your body panics and spikes your blood pressure to get oxygen to the brain. This keeps your diastolic high all day long. If you snore, get a sleep study. A CPAP machine or a dental device could literally save your heart. And third, mouth breathing. If you're a mouth breather, you're lowering your nitric oxide levels because we produce a lot of that gas in our sinuses when we breathe through our nose. Try taping your mouth at night with surgical tape or consciously practicing nasal breathing during the day. High diastolic pressure is stubborn. It didn't go up overnight, and it won't come down overnight. It requires consistency. Here's your strategy for the next 30 days. 1. Up your magnesium and potassium intake with greens and avocado. 2. Drink 2 to 3 cups of hibiscus tea every day. 3. Try the hand grip exercise 3 times a week. Give it a month, then check your numbers again. Now, if you're watching this and realizing, wait, my bottom number is actually low, then you have the opposite problem. That is called wide pulse pressure, and the solution is completely different. I did a full breakdown on what it means when your numbers get too far apart or too close together in the video that is on your screen right now. Click there if you want to keep learning about your heart health. Thank you for watching Health Pulse Haven. I'll see you in the next one.